he's 18, but he's mentally probably 7 because he's a teenager, so he doesn't have the wherewithal to.
Two different questions. So whether he's 7 because he's just a teenager, or whether he's 7 because he has a cognitive disability.
No, because he's a teenager.
Okay, then it
And he's
doesn't apply.
Yeah. What do you mean?
So you have no rights once he turns 18 as the parent, none. Where if you told me he's 7 intellectually, then
No.
you could get a limited conservatorship or guardianship. So my son has severe intellectual impairments.
Okay.
And we'll just get, when he turns 18, we will become his conservators, complete conservators over everything. I have a 9-year-old who's typically developing, and like you, once he turns 18, just like we did, mom and dad had zero rights.
Right.
Zero rights. Unless you ask your son to give you partial conservatorship over medical decisions, that kind of thing. I'm sorry.
So that is what I thought, and that's my concern. Okay.
Being
Not
a
that
mom
one would
is
be
not
done.
fun sometimes. Nobody
so
said.
basically she answered the question.
Yeah,
I don't know
but
if you're still
this is-
interested in.
No, I'm
Okay.
interested in the questions that people raise, because
Okay.
that's important. You know, the law is the law, and we cannot do much about it.
So basically, if he gives consent, I can still
Yes.
have a say. Well, not even a say, but just know what's going on.
Yes.
I still don't really have a say because he's
Actually,
18.
you can have a say. I have a 20 and an 18.
Okay.
Whether it be verbal or on a paper, depends on the clinic or doctor. On both of my young adults, even though the doctor said, oh, a verbal is fine, no one's perfect, they can't remember everything. So I did ask first my kids if I can have the consent. And they're like, oh yeah, because we don't know what we're going to do. We're going to ask you anyways what to do. Well, yes, and if you don't give me the consent, then unfortunately, I'm not going to be able to be in the room and advocate for you. So you can, once they give a written consent, once I show that to, say for instance, CHOP Hospital of LA, even though the receptionist or the front desk person said, oh, okay, I'll give it to his doctor. And I said, okay, 2 things. So that's where you have to do your own thinking. I told them, she can have a copy, but I also wanted to stick with his record. So whereas it's not only for the eyes of the doctor, it's for anyone who sees my son, because he's the one at Children's Hospital of LA. And
But you did sign a consent.
yeah,
Yeah.
Okay.
and
You
it
still have to do that.
it
Okay.
says what I had my son say right is I, Anthony Mireles, give permission / consent to my mom, and it says my name, to release any information she wants. And just by stating any information, then I am able to ask whatever question.
Okay.
I'm able to also give, tell them what recommendations, and they're able to, of course, that's my experience. Everyone
Thank you.
experience is different.
Yeah, thank you.
So the issue that you raised is, how do you want to continue to be involved in the care of your kids?
Yes.
And do you know if that information that you put at the medical record is easily accessible, or you have to remind them every time that where to find it?
It's, if they look on his, it's easy, it's both in hard copy, and they also red flagged his record electronically. So
How often people ask you to verify that, or they assume all the time? Do you think they see the red flag all the time?
I hope they do. I get alerts as far as who is looking at his files.
Hi, this is very informal. Okay, so bring the
Every
chair and bring it closer.
Here, I'll.
There are two slides that I was going to show,
Oh, okay.
but really it means not much. We'll go back to you what we. There is the International League is trying to understand, to create pathways for people to continue to get care after they graduate from pediatric neurologists or pediatricians to adult doctors. And it depends on where you live, it depends on the kinds of doctors that you may need, etc. And next year, what we're planning to do is to have a whole session that will advertise a lot more than that. So we can hear a lot more from what people have to say. Monica and I were talking yesterday, so we're trying to collect some information for whatever was here to help with that. So I can give questions from the perspective of parents, because I, as a doctor, I think different things, or I assume different things. So what I'm going to ask you is, there's pads of papers. If you write, you don't have to write your names or anything, unless you want to be contacted, which is fine too. Any things that you think that this task force should be addressing from the patient's perspective. Okay? With the doctors. Now, so do they ask you every time, do you have the right? And you have to tell them,
Oh, not if they have, if they don't ask me if I have the right, they are asking me what procedures, if I agree with the procedures, and then they'll explain to me the procedures. And
is that correct that they have to ask the parent if they agree with the procedure, if the kid is 18, if the kid given consent?
It would probably depend on the hospital's internal
Because
policies.
it would seem to me that I may give you permission to look at my record, but my
Yeah.
decision is mine.
It would depend on the scope of the consent form, yeah.
And what you gonna do when your son graduates, Chuck?
hopefully I've trained him well enough. The whole 17 and 18 years, even though I make the decisions, he's right there next to me. And say, for instance, when they called me in May to have an EEG, I had told them to call me back at 4:30. That's when my son will be available, me and my son. Every conversation I have with the doctor, even though it'll go through me, he'll be right there. We'll be on speakerphone. He'll be listening, so in that way, I'm hoping I'm training him. So hopefully by soon he'll be able to make his own decisions, hopefully.
So your concern is that your son cannot make his own decisions?
I'm not comfortable that he understands what they ask. For instance, when the doctor had, the neurologist had asked him if he contains the knowledge in school for only one day or for a whole week. And his answer was, well, if I take notes, then I'll always remember it. And she said, okay, well, forget about the notes. You understand, you grasp what's being told to you, you understand. And he told her, well, I usually ask 10 questions, and it depends on the day. Sometimes I grasp it, sometimes I don't. It just depends. So that does scare me, because especially since he does have seizures, because he's already 18, the only reason why Children's Hospital of LA calls me still, because they already, the front desk and the neurologist already knows me for so long.
So what happens at 26?
Insurance changes.
Yeah.
At 26, several children's hospitals stop seeing patients after the age of 25. Sometimes stop at 15, sometimes stop at 21. What are your expectations from the new doctors?
So hopefully he's able to make his own decisions. I'm still going to be there to guide him, but ultimately it's...
Okay, let me phrase the question a little bit differently. You know your doctor for you. Do you think that the doctor for you now sees your son is going to provide the same kind of care that they get as kids?
Oh, no.
That's what we're talking about, transition of care. How do we develop? I mean, you have certain expectations that somebody's going to pick up the phone and call you. When I'm an adult neurologist, I'm not going to do that.
I can already attest to that, because, like I said, my son sees an adult neurologist, and it's already hard to... I talk to people who have pediatric doctors, and they're much more involved. They're much more attentive. And already with working with an adult neurologist, or epileptologist, I should say, I don't want to say they don't care. They're just a little bit removed already. And I'm a very pushy parent. And once the kid is involved, or I guess he's an adult at that point, I don't see the care being the same if I'm not being that pushy parent.
Is that kind of care, though, only for the epilepsy, or is it for all the other issues?
This is just epilepsy.
How
Well,
about-
I mean, it's really my only issue, so I don't really know. I don't
I
understand.
think I would like to assume that an adult neurologist is going to understand the progression of the types of childhood epilepsies that many of us have, and some of the interventions that we've used, like epilepsy surgery. And I have found that they don't generally. So I fear that moment when my son's going to be turned over to an adult neurologist. Hopefully I'll still be alive, because he's not going to be able to explain the issues that have come up, whether from the epilepsy or
Right.
from the surgery.
Right. And you're in a
So-
completely different situation
It is.
too, because your son is
Doesn't
able
speak.
to
Right.
communicate, where my son is, but the maturity level will
Right.
not be there, in my opinion, for a few more years to come. So it's that transition that I'm kind of concerned about.
But I think it would be nice if we could know that organizations like the ILAE are educating
Yes.
adult neurologists
Yes.
about childhood epilepsies and how they progress, or what their effects are in adulthood.
Definitely.
So, we do, but we train them to understand syndromes. We don't train them to understand the touchy-feely approach. And that's what I'm going to ask you, Monica, so we finish that. It's trying to put down the touchy-feely things that you need from your doctors. And I'm not, because I call it touchy-feely, it doesn't mean that it's negative. It's just that we cannot teach doctors how to practice medicine if they have to practice every 15 minutes because they have that kind of care. So, do you think that epilepsy centers are more helpful than smaller hospitals for that?
I really can't say experience-wise as far as me. I don't know. I mean, I'm kind of new to this. I'm with Hogue, so it's more of like an adult one. I haven't, from what I hear about Chalk seems to be more touchy-feely, I guess.
No, but what happens? Pediatric neurologists, in general, we tend to play with the kids. We need to interact. We get to know them. And we know the families because we spent a lot of time with them, some of them longer than others. And then suddenly you go to see an adult doctor who has a lot of patients already there, does not have the time to try to understand what the syndrome is,
Right.
or what the conditions are, what the questions are.
Right.
And I don't know if we're going to be able to ever educate them, because the way they practice medicine is
It's
different.
completely different. Yes, I agree.
And in some institutions like mine, I tend to keep most of my kids because I'm a neurologist. I work in a place where it's both pediatrics and adults. And if I want to keep someone, I'll keep them. But the concern that I have is, although I can keep them, the pediatric cardiologist cannot. The pediatric endocrinologist cannot. Because they're not doctors.
So they have to move on to that
They
next
have to
level.
move to a different level. So how do we address these issues? But that's the way I see it from my perspective.
Can you make licensing exceptions for those other aligned professionals for this? No?
I don't know. I mean, we should. I mean, you're the force behind a lot of things that we may find to do.
I gotta make dinner tonight. So.
No, it's okay. Not tonight.
I'm kidding. We've known each other a few years.
All of you, one of you guys
Where's
thinking outside the box.
There.
We're going to share some of these things
Yeah,
as we discussed yesterday.
yeah.
Now, in some other places here, any notes? Again, I'm trying to collect information. Some other places, they say that I'm willing to see you, as a pediatric neurologist, and I could be sued unless, again, the issue of the liability comes up on how does one continue to provide care.
Yeah, I don't know how that works, but it almost has to come from the doctors, I would think. I mean, the doctors kind of have to.
They will come.
I know that they won't because
No, it
but,
will come from bureaucrats.
Yeah.
And for bureaucrats to understand it, they have to hear from patients. If they hear from doctors, it's my interest. It's not your interest. You understand what I'm
No, I
saying?
agree. I'm sorry if I said that wrong. It's like the doctors have to somehow change, right?
Well, what we were just saying, the licenses limit the ages that they can see the kids. So if I would want my son's neurologist to follow him for the rest of his life, she knows him best, she's
Yes,
limited
yeah.
by that license, which is state by state, by the way.
Come on in here. We have a totally informal conversation.
Yeah.
But I get what she's saying now, going towards my daughter's neurologist. As far as you saying they're not engaged, the adult neurologist. I do get that because my daughter's neurologist is an adult neurologist. And it's like pulling teeth.
Oh, it's major pulling teeth. It's I have to call 3 or 4 times to try to get something, and half the time it doesn't happen because I don't. It's
No, but when you're in the room,
And the reason
it's
that you're here
more
is to provide.
why you're here,
Since
have you
you
had
decide to come
seizures,
to
how do
this
you
trap,
feel, let's
I
do
wanna know your
the physical.
and then they have,
Okay,
you look
So
good,
let me
see you in
start
6
the
months.
introduction again.
Right?
yeah.
Yeah.
I'm like, no. We're
And what
gonna-
I hear from people with, who are at Chalk, for example, it's,
Totally different.
it's totally different.
Yeah.
You have more Like you want a test done. Okay, I mean, it's what it sounds like to me. It's like, oh, I really think my kid needs an EEG, hasn't had one before. Okay, let's do that. I still cannot get a doctor to give my son a second EEG because I want a more extensive one. He still won't do it. You know what I mean? Because I'm working.
So let me just summarize what I'm trying to accomplish this year. And next year, if you're here, we will try and have these two people, Danielle Andrade and Pooja Patel, that they are running this LAE task force that it was just created. Now there is a lot of issues about transition. And I know at UCLA, Jay Lerner has created a transition clinic for people who go through adolescence. This is not what we're talking about, is transitioning to care from pediatrics to adults. And it has to do not only for the neurologist, in my mind, because in some cases the neurologist can continue following the kids. It has to do with all the associated services that you need to have and to make sure that this continues to be that way. But that's the perspective that I have. There is one other slide that they created. So these are the questions that they were asking for anybody who was here to try to address. What does transitional care mean to you? Not what it means to me. Do you have a transition plan in mind? How do you learn about it? And I have to tell you that I almost never talk to my patients about transitional care. And I told you why. Because I will take care of them for the longest possible time, unless I don't like them. I have the choice. If I don't like someone, I say, okay, I'm a pediatric neurologist. But this is very rare. But my problem is that I would not necessarily get the other services or the services that you are used in getting to play along. And we need to figure it out in institutions where children's hospitals are different from the adult hospitals, which is going to be a horrible shock.
Yes.
In my hospital, as I told you, the children's hospital is in the main hospital, and I'm very happy about it. I'm very much involved with neurology, so I don't have to be concerned. But if you go from CHOC to the adult hospital, you meet different people, different mentalities. And what are the things that you would like us to work to prepare the doctors? Jay, come on. Here is the agenda of what we're trying to do. Okay? Come on, sit there. Okay?
Do what he says.
Dr. Lerner will go back a long way. And he's already trying to do the transition of care at UCLA, but my understanding is mostly in the adolescent years.
Yes, yeah, we're starting.
But do you do the transition of care when they're ready to leave you? What's the oldest that you can see the patient?
The oldest new patients we're seeing is probably around 18, between 18 and 20, and then we're kind of working around that age also to find the right fit and to help transition to an adult epileptologist or neurologist.
And how have you done that?
We're developing basically a network in Southern California and working with different adult groups to see what will be the best placement based on insurance, based on location, based on type of seizures. So we're working on different groups.
Is it, what do you do for the other doctors, not the epileptologists, but the other doctors who are involved in the care of this patient?
So one of the things, it's the new transition and adolescent center. We brought in a psychologist, psychiatrist, occupational therapist, and the idea is we're getting looking at the whole patient, looking at all aspects, so that when we are able to hand them off to an adult epileptologist, adult neurologist, we've kind of looked at all these other comorbidities associated with epilepsy to kind of make the transition easier, and also to help treat those things, which make really big improvements in life, quality of life overall.
So, do you have internal medicine doctors already lined up?
We are working closely with our MedPeds department, so we're sending a lot of people to them.
What is?
MedPeds, so they see all kids and through adults.
And how many, do you have that in where you are? MedPeds? Because we don't.
No,
Oh, okay.
no, his doctor, I was thrilled last year because I asked that question because he was approaching 18. So I asked his doctor, I said, you know, what are we going to do when he turns 18? And he goes, oh, we're good. We'll keep him till he's 21. Okay, great for mom, but again, what happens at 21?
Yeah.
Because he may not even want me at that appointment at 21, and I have to respect that. So how am I going to help him transition to finding the right doctor? Because it took us a long time to find the right neurologist that could actually help him.
Right. Yeah, I mean, no, I guess MedPeds isn't everywhere. The nice thing about MedPeds is you don't have to transition again. It's, you know, so you can start seeing them as an adolescent. So we work with adolescent medicine as well, but then you transition to adolescent medicine and then transitioning to adult. So it's an extra transition. So this is a kind of a group that sees people through the whole gamut. But if they're not available, you know, we know specific internal medicine people around that maybe are more comfortable with our patients.
But Jason, although we hear very much, and I'm a devil's advocate here, we're interested in people with epilepsy. We can expand it to the kids with other pediatric neurology problems. And then we can expand it to other parts of this, specialties in pediatrics, that eventually, that's inevitable. Thank goodness, very few kids will lose very few kids. They're going to transition to the care. So how are we going to make a system-wide difference? Epilepsy is a way to look at it, but we need to look societal. How are we going to try and make the difference for all the transition of care? So suddenly you go to find a different
I think that kind of the new idea of a team-based approach, like a multidisciplinary center, which is difficult to do, particularly financially. It's very difficult to keep together, but that's the model we're using, and bringing multiple different people together to kind of approach the patient in multiple different ways. I've spent years as an epileptologist really focusing on epilepsy, and just more recently coming to the idea that it's, you know, seizures are one thing and it's only one small part of, you know, what epilepsy is. And so treating the depression and anxiety.
You're 18, right? Huh?
He'll be 18 in April.
What do you hear from this conversation? Now, you do understand that if you were my patient, you would expect that to come at any point in our discussion.
And I love that. I love it because his communication skills.
And I would have done something different. Okay? One more thing that I would have done.
Don't be embarrassed. They're trying to help.
I would have done this.
He's gonna run out the door in a minute.
He's a teenager. Everyone cut him some slack.
And sometimes it's important to hear what you do. And then, is that your sister? Who do you think is the last? I don't know you. What do you think about what you discussed? Is that something? Would you also
Are you
help
local?
for us
Portland, okay, so this
with
can,
better procedure on how we ask kids?
so do you see a pediatric?
We do right now, and in our last visit, he said we're going to start your transition care, and then
You're like, oh, okay.
I feel like there should be a guide or something for
Yeah.
parents.
I don't think you do as well
I'd
as you
hoped he would
should,
hang on
but
to
I think
him
it's something
as our
we're
insurance
starting to do
provider,
better.
But it sounds like we're going to transition out.
The whole idea is that
And we're at Dornbecker's up
we
there.
would like to know
And so,
what do you think.
being at a children's hospital is great. Except now trying to figure out, okay, what's the next step? There's no guide. You know, what does medication look like when he turns a certain age? What is, you know, when he goes to college? be 16.
Oh, okay, so good.
We got
So
a
they're
little-
already transitioning then at 16?
They're starting the process. So that he's ready by the time he's 18.
Yeah, well. Interesting.
But there's no like, there wasn't any discussion beyond. Yeah. And he has a really great doctor. We really, really value him and appreciate him. But it's that unknown piece. Like, it's really anxiety.
Just remind anybody.
You know, and it's overwhelming how many different things we have to think about. You know, and I agree with the advocating and getting your kids to, you know, the doctor's really good at only speaking with him, and I just
But
kind of
let's go back into
there.
the
But
points of what I was
it's hard,
trying to
but
get.
it's hard.
What I would like
Let
to
go.
see is anything that you can give
I'm
us
not ready to be like,
And
oh
my
yeah.
son doesn't like talking. He's
as
like,
they're talking
we're
there.
the doctor.
Please,
He's like,
anything that you
just
want to
get
give us that we can try to think. Yeah, go ahead.
I was just, as I'm listening to this, now we're from Portland, Oregon, so some of what you guys are talking about, we obviously aren't participating in, but
You said who you are or you're not.
we're from Portland, Oregon.
So
So
what does
it
this
has-
make you special or what?
No, I just mean, you were talking about like UCLA stuff and certain programs here.
You know where I am?
No.
I mean, probably the only city that you have in this country.
Oh, New York.
All right?
Very nice.
So I'm too far away.
Oh, there you go.
Okay, so we're talking not only from New York, UCLA, Portland.
Okay.
The reason I asked Jay is because Jay is already working on something.
Yeah.
Okay, there are not that many places that they work on it. As I told you, in my institution, we don't work on it. Why? Because at least my patients are going to stay with me, but
Right.
the rest of it is not.
Well, and when he had his last appointment, the doctor already started the process for transitional care. And he's going to be 16 next month. And so so far there hasn't been like a discussion or a guide or even like I have no idea what's next. And as a mom trying to prepare him both for college and for graduation and trying, what are we going to do 5 years from now or 3 years from now? Like, this is all part of that plan. And my biggest, I guess part of my biggest concerns, of course, is the cost of medications. And when he's in college, what does health insurance look like for that? And is it covered or is it astronomical? Obviously, we're going to continue to carry him on our insurance as long as we possibly can. But again, that goes to neurology. He's going to have to see someone quite regularly, and I don't know of a guide that's available for parents.
I have a small, so I'm actually supposed to be giving a very similar talk. I didn't realize that at 12. But as part of that talk, the Child Neurology Foundation has developed an idea or has developed a program for transition. And their website has a lot of really good information.
Okay.
And I'm going to basically go through their website
Oh, great.
with
Yeah.
some slides. About some of the different things that they are suggesting at different ages, and we're actually taking that ourselves and kind of expanding on it at what age we should be doing different things, because I think it's great. I mean, for a long time, we wouldn't talk about transition until you're 18 and getting ready to be kicked out. So even the fact that even at
Right.
16 is great that they're starting.
Right.
The other thing is, as an epileptologist, I'm not great about all that. I don't know enough about all that, honestly. So I have a social worker with me.
Okay.
And so that's the other thing is other people that can help. I don't know if the setup over there, but
Right.
if you have access to a social worker, if you have access to some sort of an advocate or a case manager, they can be a lot of help.
So this task force is working for the child neurology, with the Child Neurology Foundation. They're going to find a lot of that information. But again, my concern is that we're thinking from the doctor's perspective. And that's what I would like to get out of you. Please write down the things that really bother you. And you're going to do the same thing. The things that they bother you, things that you would like to see differently. So we can share and then work together trying to improve the system as much as we can. I heard something else. Medicines.
Yeah.
With
And
the
there's
issues
usually a lot. It's not just
with
one,
the
it's like
insurance.
5.
Yeah. Or more.
That's something that we haven't thought about.
No?
So
I'm concerned about what happens after I pass away, which may be tomorrow. My son is very intellectually impaired. He's totally nonverbal. I have a backup mother who is in our special needs trust, that if we go, she is authorized to be my stand-in with the neurologist and with the caretakers about him, because she knows his history extremely well. However, it's still really frightening for me if what happens to something to her, or what happens 20 years from now.
So what,
I
you
have
don't
this
do it,
down,
you
yeah.
have this, but the way we approach that, and it's totally wrong as a doctor, you should put your kid in an institution.
I understand that.
And that's may not the choice of everyone.
Right.
They don't want to do that. And by saying put your kid in an institution, I told you to put your kid in an institution, leave me alone. That's not.
Well, he's going to have to be in a group home.
But what I'm
at
saying
some
is
point.
that the answers that we give,
Yeah.
because we don't have all this information that Jay was saying, and that's a key. What if I don't want to put my kid in a group home? What kind of things? And when they go to see the internist, do you think the internist is going to be scared seeing your son?
Absolutely.
So how do we make it easier for them? Now, what they've done in Montreal, in Toronto, they have created a transition of care system. It's a small place, and Dr. Andrade is responsible for the transition of care. So she asks people to prepare 4 or 5 or 6 or 7 pages long summaries of the patients. The issue for that is, A, I don't get paid to prepare this summary. Okay? B, even if I'm doing it because I care, the person who's going to get it on the other end, chances are they're not going to read it carefully enough to be able to deal with it. So, who should be getting these summaries? Should the doctors be getting it? Should the patients getting it? Things that, anything that you can think that you can help us provide that. And I promise you next year what we're going to do is have those 2 ladies here and some of the pain in the necks.
I think too, like along the lines of social worker, advocate, you started me thinking like, it would be great if if your insurance company were to provide you with not only the network information, but also to kind of begin that process that says, hey, I know you have a minor child who's going into the adult system. Let's communicate over the next 6, 7, 8 months, 1 year. Let me give you names of people in your network. Let's figure out how we can get them on insurance. Let's work on the medication piece, because really that's where it all starts is I can talk to my neurologist and then go to an adult, but if they're not in a network, or if he transitioned to some kind of insurance, how do we do that smoothly without a lapse in medications?
Thank you. That's a wonderful comment. Please write it down.
I did.
I did.
Did it
Because you get an advocate through your insurance for many other situations.
So it was interesting that you say it. The first time I've ever seen a insurance company, a patient who needed a psychologist. For the first, and usually it's, I have a list of psychologists, but I don't know if they're in your plan, or they're, what plan they're in, or they're cash only, which a lot of people can't pay for. For the first time, they called their insurance company, and the insurance company said, okay, let me take all the information, let you know what we need, we'll get back to you in a week, and we're going to vet all the psychologists that are in our plan, that you can see that it's comfortable seeing you. It's the first time I ever saw an insurance company do that.
But the question is a little bit different. The question is, should insurance companies take the step and trying to create transition of care mechanisms?
Yeah.
Not if the person is comfortable seeing the patient, but what
Right,
if-
but just be aware that that transition's coming. I mean, he's been under the care of the insurance for so many years, right? And you go to what's in your network so you can afford it, but that's obviously going to change when he comes of age.
It would be interesting to see in countries outside the U.S. that doesn't affect you, what the insurance is much better. If they do that.
That's it, we're moving to Iceland. No, I'm kidding.
Look, the majority of the people in this room are women. And there are some women diseases. Breast cancer is one of these. After you have a procedure, they send you to a spa for a month and a half, 2 months.
But, and your insurance will call you. Like, I had some health stuff, and I had a social worker call me about my care and what I need to include in my follow-up care. So wouldn't it essentially be very similar to that program?
Yeah.
Couldn't it be very similar to that program that says, hey?
That's what you are, and we can see what other countries are doing, because we have to deal with the system in Germany. That's international league, so we may find out that there may be something there that we did not think about. Any more things? If you think of I don't know how to make it.
Did you have any information?
If you take an extra piece of paper, if you have something that you want to send it to me, and I'll give it to them. This is my last card that I have.
No. I'll take a picture of it.
Yeah.
Just take a picture. If you have some ideas that you want to share, send them to me, and I'll send them to them. Again, I'm a surrogate for what we're trying to do. There is a hidden agenda why I'm a surrogate, okay? Do you want to know why? Because
Definitely.
we do not put two people from the same institution in the task force most of the time. And I wanted my younger colleague to take over instead of me doing it the same thing over and over. So I'm an altruist. I don't want to do the work. They can do the work. So any ideas that you may have, send them to me, and we will address it. Okay?
Thank you.
Thank you.
Thank you.